Hello everybody, I'm Dr. Mel from City Skin Clinic and welcome back to our channel. Today we're going to have a little chat about fat dissolving injections. This is a subject that comes up all the time in clinic. We get lots of people on our website asking for information about it, and it's a treatment that I think is really interesting and could be of value to a lot of people. So with this video I'm just going to kind of distill it into the core facts. So what are fat dissolving injections, who they might work best for, what the evidence there is about them, how they work, and also what you need to know in terms of what to expect after fat dissolving injections and how long they last, the number of treatments you need, etc. So before I get into it, just quickly, if you're new to our channel, please don't forget to subscribe our channel and ring the notification bell. If you're an existing viewer, welcome back. It's great to have you back. So, fat dissolving injections, well, this is something that has been around for a few years now. It's an exciting concept because for a lot of people, the idea of sort of having stubborn areas of fat deposits, so the most popular one is actually under the chin, so double chin reduction. And this is an area that causes a lot of concern to people. Sometimes it's particularly in people where it's resistant to weight loss and exercise. So you may already be fit, you may have lost a lot of weight, but it's really around here, so it's kind of genetic or hereditary. So this is a treatment that's kind of designed very much for these people. And one of the things that appeals to a lot of people is actually before fat dissolving injections, the main effective proven way to remove fat was through surgery, and specifically liposuction. And so fat dissolving injections appeal to anyone who wants a non-invasive treatment and an alternative to surgery. So the science behind it is actually there is an acid in our stomach, a chemical called deoxycholic acid, and that helps break down fat in cells, and we need it as part of our digestion. So a lot of clever people have synthesized this acid, and this has taken years and years of research, and they've been able to make synthetic forms of this acid, and research has shown when you actually inject this compound into areas of a fat deposit, so particularly fat under the skin, this compound can actually dissolve the fat, empty out the cells and destroy them, and then all of that is broken down, absorbed by your body, and then kind of excreted from your system, and it's a permanent solution. So most of the studies and the licensing has been done for fat under the skin, so double chin reduction, and that's sort of the main focus of this video, although other doctors have used it in studies and in treatments on other parts of the body, but this is the main focus of most of the studies and what the licensing is for. So at the moment there are two competitors that offer fat dissolving injections. So the first is Belkera, or Kybella as it's known in some parts of the world. And this is the original kind of fat dissolving injection. And then there is also Aqualix, which is what is available in the UK, and that's the leading competitor to Belkera Kybella. Belkera has, also known as Kybella as I mentioned, hasn't yet been approved in the UK. Both of these are synthetic forms of deoxycholic acid, and they work in a similar way. What the treatment involves is injection, usually 20 or 30 injection points around kind of the area where there is excess fat under the skin, and the idea is to contour this area and smooth it out, and the end result or the aim is to reduce the double chin, so you have a single kind of nice flat chin, and that also aims to kind of improve your jawline and have it more defined. So I've told you all the awesome stuff, but with everything in life there's always a caveat. So one of the first things that it's important to note is this is not a single treatment. So in the studies that were done on double chin reduction using Kybella or Belkera, I'm going to call it Belkera from now, In Belkera, the studies that were done show that actually it's most effective for people with mild to moderate fat under their chin. It has been licensed and has been shown to work on severe cases, but to be honest, the majority of successes have been in that group of people. Secondly, the majority of people needed something between 2 to 4 treatments, although up to 6 treatments were sometimes required. So that's really important to remember. It's not an immediate fix. The other thing about the treatments is they have to be 4 weeks apart. So if you're someone who's going to need 4 treatments, they're going to be 4 treatments 4 weeks apart. The thing with whether it's Belkera or whether it's Aqualix, this is kind of similar for both of them. The other thing that is really important to note is there's a lot of swelling after this procedure. Just like liposuction, after the procedure, after each injection, because this is how the procedure works, it'll generate inflammation, and as the fat is being broken down, you will get a lot of swelling, and sometimes it's known as the bullfrog appearance. And this swelling can last anything from 3 to 5 days all the way up to 3 weeks. And there are instructions after you have the treatment that involve propping your head up on 2 pillows when you sleep, using kind of a compression garment to help reduce the swelling. But it's really important to keep this in mind, and it's important to keep it in mind that if you are someone who's going to need multiple treatments, you're going to have to bear with this cycle of swelling and then it coming down. And let's say you're on the worst end of that and the swelling lasts for 3 weeks, then you're happy at week 4, and then you go back again and it starts again. I'm not saying that it's not worth it, but it's important to remember that this isn't a case of it's not like fillers where you go in and you can see the result on the same day, and there's not a lot of swelling afterwards depending on the type of filler where you've injected it. That being said, a lot of the positives in people who have this treatment, the things they like about it is, firstly, it's non-invasive. So yes, it involves injections, but this is not the same as going in and having surgery and having potentially an anesthetic as well. The other thing is, I personally think the positive about it being multiple treatments is it means you can refine the outcome. So on the second visit, you can see which areas have responded what most, and maybe some areas that need more focus. And so you're really contouring and controlling that situation if you're a skilled and experienced person. So you're kind of tailoring that result based on what the first treatment, for example, had, or the last treatment. In surgery, usually it's the positive is it's a one-off procedure, and yes, there's swelling and there's compression garments afterwards, but if after everything settles down it's a bit asymmetric or anything like that, then you're going to need another surgical procedure to refine it or improve it. Like surgery, both of these are permanent solutions, so the effects will last lifelong, and that's a positive about it. In terms of cost, so we don't offer this procedure yet, but based on what I know about what the product and the training and etc. costs, it ends up being sometimes comparable to surgery, depending on where you would have the operation. If you're one of the people where it's lucky and you only need a couple of treatments, then it's going to be much cheaper than liposuction. If you're on the end where you're one of the people that needs 4 or 6 treatments even, then it may be comparable to liposuction. Again, probably not liposuction in London, but liposuction in a city where plastic surgery is cheaper. So again, it's really worth sitting down and discussing the pros and the negatives about this. Obviously, in terms of complications with any procedure, anytime you inject someone, there's always a risk of something going on. So risks are, things like swelling, which we've mentioned that you definitely expect. Bruising is very likely to happen. Then there's always a small risk of infection. That is why you need to be with a trained medical professional who can handle that if anything like that happens. It's rare, but it's important to think of the worst case scenarios. And then more seriously, is a small risk that you might traumatize a nerve going here, and in which case, if one of these nerves is kind of injured, you may have an asymmetric smile. It does recover, it's temporary, but it is something that's important to bear in mind. And this is not a procedure to have if you are going to have your wedding in a week or a month even. It's something to have in advance of anything important, and it's to bear that in mind. Of course, you know, these again are worst case scenarios, but I do have to mention them. I think with every single procedure, if your practitioner isn't talking to you about the worst case scenario and how they minimize this and what would happen if it did happen, then you really need to go and get a second opinion, because you know, you make things safe by thinking of the worst case scenario. I hope that this was a useful introduction to Belkira or Aquilix, so fat dissolving injections in general. Let me know what you think of it. Let me know if you have any questions. I'm going to leave a link to our website and our fat dissolving injection page below for some more information. Just leave a comment with any questions you might have. I think this is an area that's of great interest to a lot of people, so I will be following this up with another video about other non-invasive approaches to fat reduction. If you've enjoyed this video, please don't forget to give it a thumbs up. And until next time, stay beautiful.